Welcome to Jolly's TV, where we speak about health conditions and the solutions for them, right here at Jolly's Pharmacy. Stay tuned. Do you feel sad, empty, and hopeless most of the day, nearly every day? Have you lost interest in your hobbies or being with friends and family? Are you having trouble sleeping, eating, and functioning? Well, if you have felt this way for at least 2 weeks, you may have depression, a serious but treatable mood disorder. I don't know why I feel like this all the time. I just wish I could snap out of it. What's wrong with me? Everyone feels miserable or sad at times. These feelings usually don't last longer than a week or two, and they don't interfere too much with our lives. We usually cope. However, in depression, these feelings don't go away after a few days. They carry on for weeks or months. Depression or depressive disorder is an illness that involves the mood, thoughts, and body. It affects the way you feel, think, eat, and sleep. The most common forms of depression are major depression, persistent depressive disorder, perinatal depression, seasonal affective disorder, and psychotic depression. Research suggests that a combination of genetic, biological, environmental, and psychological factors play a role in depression. Some symptoms of depression includes feeling unhappy most of the time. You may feel a little better in the evening, feeling worse at a particular time each day, usually in the morning, feeling useless, inadequate, and hopeless. Loss of interest in life and can't enjoy anything, being unable to cope with things that you used to, decreased energy and fatigue, losing interest in sex, finding it harder to make decisions, appetite and weight changes, that is, losing or gaining weight, thoughts of suicide or suicide attempts, difficulty sleeping, early morning awakening or oversleeping, feeling restless and agitated, avoiding other people, digestive problems, aches or pains, headaches, and cramps. If you are experiencing symptoms of depression, it is important to visit a healthcare provider or mental health professional such as a psychiatrist or psychologist. Your healthcare provider would conduct interviews and lab tests to rule out other health conditions with the same symptoms as depression. Once diagnosed, depression can be treated with medications or psychotherapy. Medications called antidepressants work well to treat depression. They can take 2 to 4 weeks to work. Antidepressants have side effects, but many of the side effects may lessen over time. Talk to your healthcare provider about any side effects that you may have. Never stop taking your antidepressants without first talking to your healthcare provider. Don't keep it to yourself. Spend time with other people and confide in a trusted friend or relative. Try to be active and exercise. Eat and sleep well. Break up large tasks into smaller ones and set priorities. Avoid self-medication with alcohol, illegal drugs, or with drugs not prescribed for you. Postpone important life decisions until you feel better. Keep in mind that depression is an illness, not a weakness.